What's up, bosses? Welcome to About Her Business, the podcast where we leave all the gossip at the door and get straight down to business. I'm your host, John Tay, and today we have the founder of TMJology, Miss Jessica Cordell. Now, Miss Cordell is a licensed massage therapist who specializes in TMJ and jaw pain, neuromuscular therapy, and airway focused care, among other skills. And she helps patients better understand the root causes behind chronic jaw pain, clenching, headaches, and breathing dysfunction. And she's helping us close those gaps today on what she means business. So, ladies, grab those cups and those notepads and let's get down to it. The meeting is now in session. Welcome, Miss Cordell.
Hi, thanks for having me.
Thank you so much for being here. You ready to get into it?
Let's do it.
Let's go. So, take us back to the beginning. What originally led you into massage therapy? And at what point did you realize you wanted to specialize in TMJ and jaw pain?
Yeah, so at 13, I found out that I had lumbar scoliosis. And so because of that, I worked with a lot of massage therapists, a lot of physical therapists during that time to be able to help support my back and get my strength. And so it was a lot during that time where I was like, wow, massage therapists really helped me. And I wanted to be able to do that too. And so that was like my goal. Out of high school, I'm going to do this. This is what I'm going to do. It didn't happen. And so went down a long road. I was actually a preschool teacher for 9 years. I did medical assisting and phlebotomy, and then I fell into becoming a dental assistant. And so it was during that time that I got all of this knowledge of TMJ, snoring, all of those issues there. And then COVID happened. I got furloughed as a dental assistant in 2020. And it was during that time that I was like, you know what? Everything's changing right now. It's time for me to change. And I made that decision within those first couple weeks of being furloughed. I was like, I'm going to do massage therapy school. And so I transitioned over in 2021, started going to school for massage therapy and was like, man, I don't hear a lot about TMJ massage therapists. So I'm going to take my 5 years of my background from the dental world and bring it in now into a massage practice. And once I graduated school, I just really started building up from there with my practice.
Absolutely. And a lot of people don't realize that when it comes down to entrepreneurs, a lot of our journeys start literally from that personal experience of what we've gone through and wanting to help people. And I do want to ask you a quick follow-up question. Could you explain to our audience what TMJ actually is?
Yeah, absolutely. So you'll hear a lot of people say, I have TMJ. And what that is the temporal mandibular joint. So two joints that you have in your jaw that are all a part of that jaw being able to rotate and translate, drop down. So when a lot of people say I have TMJ, I always follow up with, I'm like, I hope you have two of them. Otherwise, we're in really big trouble. But what we're usually trying to say is I have TMD, so templar mandibular dysfunction or disorder. So there's something going on that's causing that joint issues and pain and dysfunction. So that's where you hear some people say, oh no, I have TMJ, but then you'll hear providers say it's TMD. So that's the breakdown of just those few little letters there.
And thank you again for explaining that to our audience because, again, you hit on a key point with people getting things confused, especially in the medical field. A lot of people think that they have one thing and it turns out to be something else. Now, you serve a specific demographic of women dealing with complex conditions. How did you identify this niche and why was it important for you to go this deep instead of a broad audience?
Yeah. So 98% of my practice is women that come in with TMJ pain or just simple massage too. It's just being able to take care of themselves mentally and physically. And so I think a lot like of us entrepreneurs, it's like, why do you keep coming back? It's like I give them this massage, but then I check up on them. Week or two later, it's suddenly everything's back again. So it's okay. There's got to be a reason to it. I would love to say that one TMJ massage will fix all your problems. You'll never have to come back and see me again, but that's just not how it goes. And so I really started diving in deep to like the why. Like, why are people needing to see me for this service that I have to offer? And that's when I really started. You go down one rabbit hole, it sends you down 10 more. And I really started to see a lot coming from airway dysfunction, muscle dysfunction. So things that are not operating right that are causing a lot of stress on this joint. We think about how much we have to use this joint every single day. And at the same time, too, it's the one joint that has both sides has to work together. You can use one shoulder joint, one knee joint, and the other doesn't have to get involved. So the jaw has to work in harmony. And if one side is dysfunction, it's going to start affecting like the other side, there as well. And then as I kept diving down more and more, I started really narrowing it down that a lot of the women I'm seeing were ages like between 40 and 55. And I wanted to be what's a very common thing that starts happening during that time? And that's that perimenopause and menopause window where we're going through that transition. And that's when I started learning a lot about the hormone health of with the joint and how it supports the joints and the muscles in our breathing pattern. And then just really put all of that information together to be able to help that specific population.
Absolutely. And round of applause for Miss Cordell because that's literally what a real true professional does. They literally take their clients and look at the commonalities that they share and start to do a little bit of research to help them in their practice. So kudos to you, Miss Cordell, on catching that 40 to 55 and the menopause and premenopause phases and actually understanding it and expanding on it. So let's talk about how do tongue ties, because I experienced that myself. I experienced tongue ties, y'all, and y'all know that. So how do
Oh,
tongue
yeah.
ties, airway issues, and breathing dysfunction connects to chronic pain and overall wellness?
Yeah, so tongue ties. So what it is, the piece of tissue, the frenum up underneath the tongue here, if
Mhm.
that frenum is shortened, if it attaches too far up to the tip of the tongue, it causes the tongue to not be able to fully do its job. And so the tongue is involved in talking and swallowing. It also involved with stabilizing the jaw. So what a lot of people don't realize is when you're not talking, eating, drinking, your tongue should be resting on the top of the mouth. So when that tongue's not able to do that function because of limitation, a lot of other muscles now have to get involved to be able to help with the function of eating, swallowing, drinking. A lot of jaw muscles start taking place to be able to help with that lift. The jaw or the tongue, if it's not able to fully rest on the palate, bringing that stability to the jaw, then that's where we get a lot of people start clenching because it stabilizes your jaw there. Anytime you'd have movement of the tongue up, down, left, if it's not able to do that, then now the jaw gets a lot more involvement with that there. So that's how those tongue ties can cause a lot of that chronic jaw pain because now the jaw and the muscles have to work harder because the tongue can't contribute to the movement pattern that it needs to be able to do.
Wow. I was just about to say because that was a great point that you just hit on about the tongue resting. And for me, when I go through my tongue ties, my mouth naturally now just goes and rests at the top of my mouth. So that was like amazing that you just said that because it's natural for me now to do that to keep me from getting that locked jaw and just having that pain in my jaw. So I didn't even know that that was a thing.
You don't. It's like, why would you know? Like, your body learns how to function with what it's been given. And I always tell people, I'm like, it's not your fault that there's this dysfunction happening. Our bodies are amazing. They will do whatever it needs to do to function, to get you wake up in the morning, to get you through their day. But unfortunately, it can be in a dysfunctional pattern. And then that can lead down this long list of issues that will start creating those chronic pain patterns.
And y'all, she's like coming with the real evidence and the real facts today. And it's literally pretty much protecting me in a way, kind of sort of how you just explained it. And correct me if I'm wrong. Is that what it's really doing?
Yeah. So the tongue is more in an upward forward position. The jaw is mid more of a forward position. And then also when all of that happens, your airways open a lot more. So we don't have a tongue and a jaw sitting farther back. And so it's also a way that your airway stays open with that proper tongue posture.
Wow. Y'all see, and that's why I like to always use myself as the example because when I have my professionals in front of me, I real deal have to get that advice. And she just gave out some amazing evidence based type stuff that I had absolutely no idea was a real thing. I was just doing it naturally and thought something was wrong with me, honestly.
Yeah. And you're like, and you have people tell you just do this. And if you physically can't or you don't know how to, how can you improve those symptoms and that chronic pain? You just don't know.
Absolutely. And let's talk about what are some of the biggest challenges you face while building a practice around something many people still don't fully understand, like we have just talked about.
Yeah. So, as a massage therapist, me starting to talk to someone about airway and hormones and breathing, everyone's, what are you doing? You're a massage therapist. Just make my body feel better in that session there. This is not your scope of practice. What are you talking about? And I completely understand that. But yeah, like, it's like going into the dentist or they want to know, how's your big toe feeling? It's, why are you talking to me about this? And so it's a lot of education with it. So why am I talking to you about it? Because the TMJ is a victim of your dysfunction. And so, why I want to know about your breathing, about your airway, about your tongue posture is because those are big contributors to your pain. So, you can come in and see me for a massage. I can get you nice and relaxed. But then I also offer that. But if you want to know why next time, let me know. And I can start bringing up these topics to you. And then suddenly now all these dots suddenly get connected that you probably have seen 12 different providers before, and each one has educated you on the individual point. But now, when we're going to work together, we're going to pull all those dots together so you have an understanding of why all of this is going on.
Absolutely. And once again, a true professional because I can remember being back in practicum and I was checking that mental health level and I was greeted with, why do you care? And that's, you know, one of those things that professionals have to understand in order for the whole thing to work. You have to focus on those little things. So again, Miss Cordell, kudos to you for having the courage to step out there and ask about people big toes. I mean, it may seem silly to y'all, but at the same time, it's very important and it literally goes into helping a person, honestly.
And what I always tell patients too is when I connect the dots to the airway, to the menopause, and on those symptoms, I'm not treating you for that. I'm just bringing awareness to those issues. And now I've built a team of providers who I know are going to help and listen to you. And now they're going to work with you. So I kind of tell a lot of people, here's what I can do, but also let me be your advocate now because you're so exhausting and you feel lost in the healthcare system, especially with TMD issues. It's so complex and confusing. So I'm one of those when you come and see me, because I even do virtual care where you can see me virtually. And so even if you're in Colorado or out of Colorado, I've got you. Let me tell you, like, okay, here's where you live. These are the providers I know. Go see them. They're actually going to help you now.
Absolutely. And y'all, she just said that word outside. So you don't even have to be inside Colorado to contact Miss Cordell. And I'm definitely, can you let everybody know what all states you're able to see yourself in as far as your virtual experience goes?
Yeah, so right now I can see really anyone from any state with the discovery calls that I do, with the neuromuscular therapy that I do. But it's one of those where if people are like, "No, I really like that in-person care," then I'll send you over to someone like I know, like in your state there. But obviously, all body work must be done in office with me if you want to get that actual massage experience.
Absolutely. And you're creating literally a reference list of great other professionals and helping them out as well. So kudos to you. And once again, that is literally what goes into being a true professional. And I'm gonna keep saying that throughout today's episode of what a true professional really is. It's seeing the signs, helping somebody. And sometimes, again, as she just said, that in-person experience can change your life because there is the massage aspect of it, and you do have to go in person in order to get a massage. Y'all, they can't just do it through the screen. So having that list of people who you know are truly in it to help people, that is another great point that you just made, Miss Cordell. So let's talk about how did you position and communicate your expertise so that clients not only found you but trusted you with these sensitive and often overlooked issues?
Yeah, I just listen. Like, how many of us have gone into the doctor? I just had an experience where I was saw a new provider and they saw me for 6 minutes. And that was it. That's the only time that they gave me as establishing as a new patient, which blew my mind. What are we going to do in 6 minutes? And so I have made my initial evaluations 2 hours long. We are going to have this conversation from what happened in childhood to where you are right now, because that is going to give us a lot of information to help you. And for a lot of my patients, the first 20 or 30 minutes is just them talking, and I'm sitting here and listening to you. I'm not interrupting, I'm not asking you questions. I just let you talk for a change, because how many of us just want someone to listen for a change instead of interrupting? So as you're talking, I'm making my own mental notes of follow-up questions that I need to do. And when you finally feel like you can take that deep breath after getting everything off your chest, then we're going to dive deeper into all of those concerns that you just shared with me.
I don't care if you're a massage therapist, a counselor, a psychiatrist, or a family doctor. That active listening is literally your gold mine for helping your clients. You real deal have to create that space where they're just able to let it all out, because that's what it takes in order to provide treatment. You have to let your clients be themselves and tell their own stories, their own personal way. And a lot of times, as Miss Cordell just said, a lot of them just want somebody that will listen. So again, true professional moment. I love it. A lot of people don't get that active listening skill down pat, and they just want to go off the top of their heads. And next thing they know, clients are complaining and everything else. And that's literally why, because you're not active listening. So let's talk business structure. What systems or strategies have helped you consistently attract and retain the right clients?
Yeah, for me, I quickly noticed my referrals, like networking with so many different providers, because our bodies are connected. It's not just you come to see me about your jaw. It could be your diaphragm that caused your issues. It could be your spine that's causing some of your dysfunction. Your brain. So for me, just to stop and just look at your jaw and nothing else, that's not going to help us. So I'm working with physical therapists, pelvic floor physical therapists, other massage therapists, personal trainers, dentists, orthodontists, gynecologists. I have perimenopause nurses that I use. Again, I have this team built up of referrals, because I can help you here, but I also understand that what you've shared with me, this is going on. So here's your next team. Here's your next provider that you're going to see to help you. Because at the end of the day, our TMJ pain, that dysfunction, it's a whole body system that's causing that effect there. So if I can hear what you're telling me and been like, I know exactly who else you need to see in your treatment plan with the time, the finances, that's important to all of us. Time and finances are everything. So instead of wasting your time seeing 6, 7 different providers who don't know what to do for you, I know exactly who you're going to need to see with the system and referral system that I've built up.
Absolutely. And y'all heard her referral. Well, I can't say that word right now, but her system and her list. And I know a lot of people was thinking you was gonna go this massage therapist, that massage therapist. No, you literally gave, gynecologists and menopause experts, and that y'all again, true professional moment. That's what it takes, y'all. It takes a community, and it does not mean that we all have to have the same title, but in order to literally create a community that literally serves and helps others, it does take a combination of different people in a different titles. And I'm so happy Miss Cordell came prepared for y'all today. Now let's talk about your background in wellness and education. How have you turned your knowledge into a profitable, sustainable business?
With my patients who come and see me, whether they find me on social media, whether they come through a referral, I have made my business successful because my patients trust me. They know when they come and see me that I'm not just here to take your money, take your time, and be like, yep, what I did will fix everything. You can move on about your day. You never have to see anyone else. I don't. It's like I'm very aware of what my limitations are in my scope of practice and the services I offer. And as well, a lot of us, you hear about these free discovery calls, and it's like a sales pitch, which it is. That's how we make money. We have to sell ourselves and everything. But there's a reason I have such a broad category of services. You can meet me for 30 minutes for free. And a lot of that time in that discovery call, half the time you might not even end up working with me directly or starting with me because I know what's going on and this is who I need you to go see first before coming back to me. And so I think when patients hear that, it's okay. It's not just, oh, you saw me, you have to buy this program, this package, do this and that in order to get better. I might be the person in the middle of your treatment. I might be the last person in your treatment when you come. And so I feel with patients, it's wow, she's not just here to do this free discovery call to sell me on what she can do. She's here to help me and guide me. And it's possible that her services will come in at some point when it comes to our care together.
Ooh, I know y'all tired of me. True professional. And actually, probably my most favorite moment of today's episode, you could sit down and talk to her for 30 minutes for free. And in that 30 minutes, she could determine if she's the person you need to come see right now, or if she's in the middle, or if she's at the end. And she knows exactly who to send you to. That right there, that's a skill that a lot of people who've been doing it for 30, 40 years still haven't mastered. And Miss Cordell, again, thank you for being that person that just does not go, okay, well, give me your money. I'm going to be the person to fix everything. You're the person that real deal wants to see people succeed in life. And I truly appreciate you for saying that because that's another place where people don't do. They don't send people out to the right people. They just think that they can fix it themselves and then everything goes wrong. So another great point, Miss Cordell, on that one.
Thank you.
Now, let's talk about the role of content. How has social media workshops or even client education played in growing your brand and authority?
Yeah, I have always my social media is like an education source when it comes to it. What you'll see on my Instagram, I really zone in on okay, yeah, I help you with TMJ, but my big zone is like breathing, airway, hormone, and hypermobility, like the EDS community. So those because I've extended a lot of my knowledge in that community there. And with it, you can not only do I have those discovery calls, but I also have ebooks and resources because I want to give you pieces to your puzzle. I always tell people with TMD, this is a 100-piece puzzle, and I may give you 3 pieces to it. And so here's the ways that we can do it. You have my free resources, you have my on demand, because again, if you can't see me in person, I have on demand courses and programs for you to learn and try yourself. How many of us DIY everything before going to the professional just to see if we can fix it on our own? Time and finance wise, too. And then from there, we go up. I'm able to work with professionals who want to learn from me with the certain techniques of the knowledge that I have, or people who want to come in and see me as office there. So every interaction that I have with every patient, with every provider, it just gives me more and more information to be able to help the next person.
And she putting y'all on because again, she wants you to be not only healed from this process, but she wants to educate you as well in what you're going through. Because I think that's another great point on a true professional. Because a lot of people who may have just experienced this for the first time or may not know anyone else who was going through it, it could be a scary thing coming to a professional and admitting what you're going through. And a lot of them do be looking for that openness of what's happening to them and what the process looks like. They look not only to help you, but also educate you in the process of what's happening, just in case, you may move to another state and can't come see them another time. So that's literally a true professional, y'all.
And just to say too, I'm a provider that has no problem saying, "I don't know." I don't know. And honestly, it's been that mentality that's made me go out and get the information that I've collected now because I'm someone who's, I don't know, but I'm going to find out now. Whether it's I can find out the information and give it to you or apply it in my practice, or I find out the information and I now know the providers who I can send you to be able to help you with these issues.
Absolutely. Another true professional moment because, everybody thinks that they know everything, and sometimes you just may not have the knowledge of the particular area, and you may need to do a little bit more research in it before you actually give out that clinical advice. So I appreciate you, Miss Cordell, on being that person that says, hey, I don't know, but that don't mean I won't know tomorrow type of
Yeah.
person. Because I
Yeah,
love that about you. You're gonna make sure that you go find out. I
exactly.
understand that though, because a lot of people would just go on with it and just try to give that clinical advice, and you may not necessarily have all your ducks in a row. So that is a great point to make. Now, let's talk about because women, we normalize our pain, especially around things like migraines and jaw tension. How do you shift that mindset in your audience and your clients?
It's hard being a woman sometimes. It's exhausting. We are very much taught early on that we have to take on not only the responsibility, but ourselves, but for everyone around us. Everyone depends on us as a woman. But I'm also one of those where my patients come in and I look at them, I'm like, it's okay to say this sucks. It's like, oh, stay positive, do this, but no, sometimes it sucks. And just getting to say that out loud feels really good just to get that feeling out loud. Letting out that's what I'm here to listen for. Don't worry, I got you. I'm someone who's like that, where I'm like, oh, this sucks. Can I spin it, make it a positive moment? Yeah. But I want to acknowledge what I'm feeling in the moment, and then I'm going to move on from there. So being able to help women with that, to be like, yeah, it's hard being a woman. This sucks sometimes. But what? There are ways that we can help and improve things. And I'm going to help you do that now.
Absolutely. And everybody knows I love a lived experience professional. And with women being women, we understand that we just go through things in life and we normalize everything from pain to burnout as just normal things in life. When a lot of women are now starting to realize that it's okay to admit, hey, I need that help. And another area where women just thinks it's normal and just go through the functions is during the premenopause and the menopause stages. You've talked about collaborating with other professionals. How do you collaborate or integrate with other professionals in those areas?
Yeah, so hormones affect everything to your joints, your muscles, your tendons, your soft tissue, things like that as well. And so when it starts to affecting those symptoms, when those hormones start to drop in those levels, we start to lose support in our body. And so we want to be able to acknowledge those with those other professionals. And if it's muscle issues, I want you working with a pelvic floor PT. I want you working with a personal trainer. If it's airway issues, I want you to work with an airway specialized provider who can do scans of your airway, who can give you appliance therapy, being able to do all that. If it's your nervous system, I want you to, yeah, there's great breathing techniques, but there's mental health providers, there's talk therapy, there's all these little different areas for you to be able to address that I want women to be able to get looked at and helped because it affects every system of your body.
Absolutely. And speaking of therapy and things like that, let's talk about your boundaries for a second. What boundaries or practices have you put into place to protect your own energy while still holding space for clients that's dealing with chronic pain?
Yeah, I have to remind myself that I am also a client who deals with chronic pain. And so I have to give myself grace in those mental health days and those physical health days as well. So with my business, my hours and my days are this. Those are the days I operate in. The days that I'm off, those are me days that I have to take care of myself. And yeah, if you email me on a Saturday, I work Wednesday through Saturday. If you email on a Saturday at 5 p.m., you might not hear back from me until Tuesday or Wednesday because I can't be on 24/7. The providers you're seeing are also humans too. We're not AI, we're not bots. We can't be on 24/7. So really learning that boundary because and before that I was working 7 days a week. Anytime someone would message me on social media, it could be 10 p.m. at night, I'd respond back to. And yeah, it affected my mental health on all of that. So I needed to start being able to do that. I have found little hobbies that I absolutely enjoy. I got into embroidery, which I have absolutely started loving to do. It really helps me really just focus in on the stuff. I like coloring. It's all little things that I can focus on in the moment when I'm being able to do that as well. So just little basic things, little hobbies, and then just telling me no. Because I'll say yes to anyone every day if they want to see me, need help, need advice. But I have to tell me no as well and remind myself of my boundaries.
And those are some great boundaries to mention because, as you just said, helping others, it can take a toll on you and your body eventually. And you do have to learn how to give yourself that grace because I'm just like you, Miss Cordell. I go 24/8 if I got to.
Yeah.
Just that's not healthy, y'all. So again, Miss Cordell, thank you for sharing with our audience. And I love that you mentioned embroidery because I'm actually and getting into that. So we're gonna talk after today's episode.
Yeah.
Let's get some advice for our women out there who may be interested in starting a practice like yours. What would you tell her right now?
Educate yourself. Just because someone is coming in with jaw pain, we need to figure out what's causing their jaw pain. And so you can learn all the massage techniques, you can do all these massage courses, all these CEs, but it's not going to figure out why they're seeing you for the massage in the first place. So getting if a CE course is for PTs, OTs, but they'll let me come in and take it knowing, hey, this is your scope of practice. I don't care. I don't need the CE. I just want to learn the knowledge so I can better help my patients every single time that they come in. Networking is huge. Don't just network with massage therapists. Network with everyone in the healthcare system because everyone sees everyone in the healthcare system. And that networker, that provider, they don't know what you do. They don't notice in patients to you if they don't know your services where you're located. So if it might seem silly to go into a personal trainer's office and be like, hey, by the way, here's this information, or going into a gynecologist's office, they don't know that connection. So don't be afraid. It seems silly to network with some people. They all need to know. And also, someone knows someone with TMJ pain or jaw pain or wears a night guard. You just sharing yourself might not get you that provider, but they know 5 people who need your services and they're going to share that with you as well.
Absolutely. And those were some great tips, y'all. It doesn't matter if you want to start a practice dealing with TMJ or get into the massage therapy field or just get into, any other type of industry. Those were some great tips. Like you got to get out there and network. You got to educate yourself. Like education is very key when it comes to healthcare. And even if you are, like Miss Cordell said, going to get those CEs, or if you're just going to get the education, because I was a student, I knew I wasn't going to get no CEs from it, but I was still going to educate myself in it. So I go and knowing I'm not going to get nothing from it as far as a certificate goes, but I just want that knowledge. So Miss Cordell, thank you for hitting on that point. So y'all don't be scared to go out there and educate yourself, even though you not may not get a certificate from it.
Absolutely.
So we're getting closer to the end of today's episode, and I want to talk about your biggest misconceptions. What are some of the biggest misconceptions people have about breathing dysfunction and airway health, in your opinion?
I say it every single day on every single thing that I do. Just because it's common doesn't mean it's normal. I don't know how many times people come in. Everyone in my family snores. All my grandparents are on CPAPs. Or yeah, I'm an adult now. I'm just tired during the day. It's just what being an adult is like. It's not. It's not those things. And on sleep disordered breathing, it has a spectrum. Snoring or mouth breathing is the beginning of that spectrum. There's something going on for you to have to breathe through your mouth because you should be able to breathe through your nose 24/7 in and out with no issues. If that doesn't start to get addressed in the beginning, then you get into the snoring. And so it's even more, something worse is happening because now we're snoring. And then from there, you start getting into the actual obstructed sleep apnea, the central sleep apnea, where your body is fighting for its life because it can no longer breathe because something's interfering there. So, by the time you get to that point, if you are on the point where a doctor or someone is starting to tell you CPAP therapy, you have gone through a lot of different spectrums. You're just not aware about it. So just because someone snored, just because grandma and grandpa are on CPAPs, you don't have to be that person. You can catch it on that spectrum of sleep disordered breathing and possibly reverse it before you get to that end stage of needing CPAP care.
Oh, wow. And thank you for hitting on that. You got to break the curse, you got to break the cycle, because a lot of people do refer it back to, as you just said, generational.
Yes. Oh,
Now, sadly, we've come to the end of today's episode, and we always leave with a legacy. I give you a couple of minutes to think about this. When you think about the impact of your work long term, what kind of legacy do you want to leave?
yeah, I loved this question that you gave, and I really thought about it, and for me personally, where I'm coming from, I'm always saying, "You're not just a massage therapist. You're a manual therapist, you're an educator, you're an advocate. Continue to grow, continue to learn, and continue asking questions because something I follow and live by is you don't know what you don't know, and what you do know is not enough."
Absolutely. And I'm going to add something else to it. You're a change maker. And that's very hard to do, because when you come into the field, everybody just want to come in and just fit, grow as the years go by. But Miss Cordell, you are a change maker, a groundbreaker even. And I just truly have enjoyed having you here today and getting your level of expertise, because it has definitely been enlightening for me and for my audience. And I'll give you the last word before we adjourn today's meeting.
Oh, thank you so much. I just want everyone to know if you'll will sit and listen to me, I will talk and talk and talk. So really having this amazing platform that you have set up is absolutely wonderful, empowering women, getting us out there to helping others. I couldn't do this without your platform as well. So thank you so much for not supporting me, but all these other amazing women you've been interviewing with your platform.
Absolutely. And again, before I adjourn today's meeting, because I literally skipped right over it, let's get all Miss Cordell's information. Let us know how we can sign up for your services. Let us know all your socials. Let us know all the details.
Yeah, so you can find me on Instagram at TMJology. I have my website, www.tmjology.com. My email, tmjology@gmail.com. You can go onto my website. That's where you can get also that free discovery call, set all of that up as there as well. And I have all of that content information available on my website.
Absolutely. And I will be leaving all that information down in the description box below. And with that, ladies, today's meeting is now adjourned. Thanks again to the founder of TMJology, Miss Jessica Cordell, for coming on and sharing her insights. And you be sure to subscribe to About Her Business wherever you receive your podcast so you never miss whenever we upload. Also, leave me some comments down in that comment section on which industry you think I should interview next. Until next time, keep those goals tight, that circle tighter, and that bank account growing.